Welcome back. It has been 9 months since Canada began its nationwide COVID-19 vaccination program. Since then, more than 79% of those eligible have received 2 doses, which is pretty high compared to most other countries. But as doctors have warned, and as we've seen from the latest wave of infections, it's certainly not enough to end the pandemic. So let's try to understand a bit more the cause, the stakes, and the solution to the problem with 2 doctors joining us right now. We've got Dr. Warda Iqbal, a family doctor who also spends time in the community providing information, help, and guidance to those who have yet to get the vaccine. We also have infectious diseases specialist, Dr. Suman Chakrabarty, joining us. Hello to both of you. So, we saw in Joanna's reporting a whole variety of perfectly understandable reasons why people might opt not to get the vaccine. But I'd like to hear from both of you. What have you learned from your conversations with those people? Dr. Iqbal, maybe I'll start with you.
Sure. Hi, Andrew. Thank you for having me here today. So I guess the first thing is I don't really like to use the term vaccine hesitation as much as I like to talk about instilling confidence when it comes to these vaccines. What I've been finding, especially through my work in the community, is that there are a number of reasons that people might not have this confidence. And 2 of the things that I've been seeing a lot, especially in the last couple of months, are number 1, might be mistrust, which comes from experiences that people have with the healthcare system, whether that's here in Canada or maybe it's back home with that healthcare system. And I think number 2 is just trying to sift through the amount of information that's out there. It's hard for people to be able to navigate the information that's coming at them so quickly. And this could be because of maybe people are busy, they're doing double shifts, they're essential workers, or it might be because it's in a language that they don't necessarily understand. And I find that these 2 are the most common reasons that people still don't have the confidence that they should have at this point in the vaccine.
And Dr. Chakrabarty, what have you learned, or have you been surprised by anything that your patients have told you?
Yeah, absolutely. I think the biggest surprise is, and it shouldn't be a surprise at this point, is most people are not against taking the vaccine. They just want to sit down and have a conversation about it. And the surprising part is I'm sitting there ready often with numbers and figures, but it's not that. They just want to have the conversation, feel like they've been listened to, and have reassurance coming from somebody who knows what they're talking about, which I guess would be me. But the point that I'm trying to make is that if you have the compassion and alleviate concerns, this really does help a long way in reassuring people that it's safe and get the vaccine.
Speaking of numbers, Dr. Chakrabarty, we heard Joanna refer to, the idea of herd immunity. Do we even know what that magic number even is nowadays, given how transmissible Delta is?
Absolutely. This number is much higher than it was before. And, this is a dynamic situation. This is a model that we use, but it's around 90% in terms of immunity that can be from the vaccine, or it can be from natural immunity as well. But it's much higher than with the classic COVID. It's something that's going to be harder to obtain. We will get there at some point, but we do have some work to do.
But I guess it's funny to think that herd immunity is very much a local concept, right? It only matters on a local level, not really so much on a national level, right?
Absolutely. I mean, what we're seeing across Canada is an aggregate of many, many different processes happening in different parts of the country. So, when you look at it, you can get a herd immunity in an area, it can change, and you can get it across the country eventually. But the point is, yes, you have to look at what's going on in the geographical region, go to the problems that are there, address them. And the main thing is get vaccinated. That's our best defense that we have.
So, Dr. Iqbal, what works in those conversations that you have with your patients, just in terms of, arriving at some kind of joint common understanding about how best to approach the question of vaccination?
Yeah, so what we've been finding is that what we have been doing recently is we're doing a bunch of pop-ups that really brings the vaccines closer to people. So we've been doing pop-ups when it comes to buildings in the lobbies. We might be at an intersection somewhere, just setting up shop there. And what we're trying to do is we're trying to build confidence by bringing vaccines to the people and trying to make it more convenient for them. Furthermore, I think what we're trying to do is we're trying to create a space where people don't feel judged. They feel like they have a safe space. I think we really need to understand that when it comes to lack of confidence, it comes from a set of beliefs from a set of values, and we need to be in a position where we can respect that. Having a conversation where we listen to them as opposed to talk to them, and when this is done in a way where people don't feel judged and they feel like it's an informal conversation, really opens up the doors to be able to have these conversations and move towards building that confidence.
Well, clearly there's so much more time needed to have a fulsome conversation about this, but this is a good start. Thank you, both of you, for your time. Really appreciate that.
Thanks for having me.
Thank you, Andrew.